Well, the Western Cape recorded the second highest number of new infections in the past 24 hours, with over 1,200 new cases. Officials are calling on residents to be vigilant due to the spike. Let's get more. We can speak to the Western Cape Health Head of Department, Dr. Keith Klutter. Thanks for your time, Doctor. We appreciate it. So let's start with the latest numbers, and of course that causing concern in the Western Cape. How are your hospitals managing?
Good evening, Sean, and good evening to your viewers. At this point in time, we've just got over 1,100 people with COVID admitted to private and public hospitals, about 600 in private hospitals and about 490 in public hospitals. So the capacity is not severely under strain yet. Our private hospitals are starting to feel it, but the public sector hospital still has quite sufficient capacity. But these increases have been steep in the last 10 days. That's why we've entered the third wave, and we've made a strong call on strict restrictions on gatherings so that we can still curb the impact on the healthcare system.
And let's talk about the vaccination process as well. Of course, we know that the more people who are vaccinated, the safer we are in terms of a population, but we are still waiting for vaccines to arrive. How's it looking in the Western Cape? I read that you were trying to ramp it up, but you're also waiting for vaccines like the rest of the country.
Yes, so we have been ramping up, Sean, and we have the capacity to do about 140,000 vaccines per week. Because of the supply constraints, we can only do about 70,000 a week. So we have the capacity to scale up quite significantly. But we have been doing about 60,000 vaccines for the last 2 weeks. So today we recorded again 15,000. So we can go up to about 24, even up to maybe 26 or 30,000 vaccinations per day if the supply comes through. We've been told by the National Department as of next week the supply will start stabilizing and start increasing. We probably are going to hear some announcements over the next week about, in addition to the Pfizer vaccine, some Johnson & Johnson vaccines. So we are opening two mass vaccination sites as well. One at the CTICC on the 1st of July. That vaccination site will actually run 7 days a week for 12 hours a day. And with that coming online, we hope to start moving towards 25 to 30,000 vaccinations per day in the Western Cape.
Yeah, and of course, the President said that we should be getting 2 million new Johnson & Johnson vaccines by the end of the month. But I remember the Western Cape was trying to procure its own vaccines. How's that going?
Well, we have an acquisition team. They've reached out to all the producers, the manufacturers. You recognize we are limited by the SAPRA regulations or the registrations. So only Johnson & Johnson and Pfizer is currently registered under emergency use under SAPRA. We have approached both Johnson & Johnson and Pfizer. Both have indicated to us that they will be dealing directly with the National Department and not with any subnational entity. So at this point in time, we cannot directly access. There was another complication, and that was the no-fault compensation scheme as well, which, according to the legislation and the regulations that came out, it only covers vaccines that's procured under the national program. So we are obviously considering all these options, and at the moment we are very much participating and dependent on the national supply of vaccines.
Yeah. So are you considering walk-ins like we are doing in Gauteng? We're now going, away from that EVDS system, SMS, that elderly people have to wait for in this province, and old people are being told to walk into facilities to get vaccinated. Are you doing the same thing or no?
No, we are very much still working with the EVDS system. It's taken a while. It's stabilized. We have much more predictable vaccination and appointments coming through under the EVDS. So majority of our people actually attend now according to the appointments that they've got. We have made sure that we've now got vaccination sites. We have more than 205 active sites in the province, and we try and make it sure that we have close proximity to where people live. So the system has started stabilizing. The SMSs give people appointments close to where they live. And we are giving that the full go. So we prioritize people with appointments, And then we still have small numbers of walk-in, but the walk-ins are getting less and less because people are starting to get their SMSs and the appointments are coming through.
Doctor, just try to talk me through what's happening in terms of people under the age of 60. I've also seen some non-essential workers who are, 30, 40 years old, also getting vaccinated in the Western Cape. Is that allowed, and is it happening because you have to use doses that are already opened for the day that have not been used because people didn't pitch up? How is this happening in the province?
Let me clarify. The first one is under the healthcare worker, under the Sonke trial, there was then people registered on the system because it did not limit you by age. It also didn't limit you by professional registration. What has happened under the healthcare registration portal, people then saw that as a loophole, and then people started abusing that system. People misrepresented themselves as healthcare workers. That system had to be closed because of that abuse. Now, there's still people through that system that are getting appointments, but they're supposed to be healthcare workers. So if you're under the age of 60 and you come to for vaccination, we are now doing strict verification at the site to make sure that you have credentials to show that you are a healthcare worker. In addition to that, unfortunately, there's also been some medical aid load-ups on the EVDS system, where people under the age of 60 have also been loaded up automatically onto the system. And some of those appointments have also come through. We've reported that to the National Department. They're very much aware of it. And again, they're trying to close that specific loop. The policy is very clear. At this point in time, you have to be over the age of 60. You are being blocked if you're not over the age of 60 to register onto the system. And we are really prioritizing people over the age of 60. Other than that, you're supposed to be a healthcare worker, and we're opening a special portal now for healthcare workers with their professional registration to also be able to register. So where people under the age of 60 are being immunized, it is possibly under those two loopholes, but we are clear to close those two loopholes.
All right, interesting. Thank you so much for your time. We appreciate it. Western Cape Health Head of Department, Dr. Keith Klutter.